Rebecca would have been 5 years old this year.
When I brought my 7-week-old child to the pediatrician, I knew she was sick.
Daniel's heart rate was over 280 beats a minute.
The emergency room doctor said, "Don't worry, you're being overprotective, you're being neurotic."
Within a heartbeat, our life changed.
She passed away the next day.
You never get over the loss of a child.
We created the RBaby Foundation to make sure that no other family feels the pain of losing a baby. Our goal is to make sure that any baby in an emergency situation gets the appropriate care.
What we focus on is working with doctors and with physicians to understand how we can improve medical health care for children.
Babies are not mini adults.
The care that they need is not the same.
A fever on an infant is very different than a fever on an adult.
An enteroviral infection is nothing but a common cold in an adult.
Thousands of babies die every year because they are not properly evaluated, diagnosed, and treated.
Every single parent may face a pediatric emergency.
Liv was resuscitated 6 times that night.
The lack of standardized regulations is something that I don't think most parents are aware of.
I just assumed wherever I went, if there was a doctor, there was a trained professional.
There's no standard criteria that you need to have a certain number of hours of continuing education in pediatrics as an emergency physician. But we're hoping together with RBaby that we can help to standardize who can take care of children in emergency departments.
RBaby is trying to make sure that we have qualified pediatric specialists in emergency rooms.
Our focus is with improving medical training, and creating blood libraries, and a whole host of different grants led by our medical advisory board and our board of directors.
Foundations such as the RBaby Foundation are exactly what we need to take steps right away to educate the people who are seeing the children in emergency departments now.
These past 5 years, we've had great success with our grant programs. We partner with top children's hospitals that create programs that benefit all hospitals nationwide.
One of the grants has to do with a call center and a question line for emergency physicians to call into a pediatric specialist.
The Poise Network program reaches out to hospitals all over the country and all over the world who are learning on infant mannequins to feel comfortable treating pediatric patients.
RBaby's Poise program is now at more than 100 hospitals nationwide and is training more than 20% of all pediatric interns in the country.
The simulation-based experiences actually save lives. They actually improve outcomes for infants and children.
We also work directly with parents in helping to empower them with programs that help them learn to communicate with hospitals.
It can possibly even empower another parent to listen to their maternal instinct.
If you don't advocate for your child, who is going to advocate for your child?
We felt comfortable, we were okay with asking questions. They listened.
All the people that we're training are going to go out to more places, so they're going to continue to pay it forward and hopefully continue to use some of the training that we provided them.
I know that they're supporting all sorts of programs that are going to really make a difference.
The scale of that is unbelievable. The time to do it is now.
To have the tools that RBaby has to offer to people is just absolutely invaluable.
They're changing medicine the way it needs to be changed.
It's comforting for me to know that I'm part of that kind of effort.
As a father, there is no more important cause to have participated in than RBaby.
The cure for this is there. It's just getting the word out.
These are tragedies that absolutely do not have to happen.
The more children we can save is a cause that needs to be fully supported.
We hope that you'll join the RBaby family. Your support will save many babies' lives.
RBaby is going to make a difference.